So the CannabisCINV trial was a collaboration between the NHMRC Clinical Trial Centre at the University of Sydney, the Chris O'Brien Lifehouse and the Lambert Initiative, and it was a seamless phase 2/3 placebo-controlled randomised trial assessing the efficacy of THC and CBD oral cannabis extract for the secondary prevention of chemotherapy-induced nausea and vomiting. Eligible participants were adults with any cancer of any stage who were receiving intravenous chemotherapy of moderate or high emetic risk and had already experienced chemotherapy-induced nausea and vomiting in a previous cycle of treatment despite guideline-consistent anti-emetics. The study drug was an oral cannabis extract which contained THC and CBD in a 1-to-1 ratio with 2.5 milligrams of each in each capsule, and the study drug was given over a 6-day time frame, starting the day before chemotherapy in a TDS schedule. And there was a self-titration schedule which allowed patients to increase or decrease the dose based on their experience of nausea and any side effects. So the study was conducted in 2 parts. The first component was a phase 2 crossover trial design with 80 participants, and the phase 3 component was a 170 participant parallel design trial. And together these studies were combined to look at the overall efficacy of the oral THC and CBD in addition to guideline consistent anti-emetics for the first cycle of treatment. The results, the study actually closed early due to poor accrual, but with the 147 evaluable patients for the overall study, it was positive nonetheless. Despite closing early due to poor accrual, the study met its primary endpoint, and there was an increase in the rate of the complete response, which means no nausea and no use of anti-emetics, from 8% in the placebo arm to 24% in the THC CBD arm, so an absolute difference of 16%. The p-value was less than 0.01, and the number needed to treat was 7. In terms of safety, the most common, there were no SAEs attributed to the medicinal cannabis, but there were some adverse events of special interest, known cannabis-related side effects. So 1 in 5 and 1 in 10 experienced moderate to severe sedation or dizziness respectively, but otherwise the study drug was well tolerated. Our study establishes the role of oral THC and CBD in the secondary prevention of chemotherapy-induced nausea and vomiting alongside guideline-consistent anti-emetics, but we don't have answers around primary prophylaxis and also in terms of the therapeutic hierarchy for prophylaxis in relation to olanzapine, which is another proven product which is used commonly and is in most guidelines.